And right here, let me show you, right here is when the life expectancy went down for the first time in humans in the US, actually, right? And so I don't think this is an accident whatsoever. 2025 is the year it was predicted 55% of healthcare professional will have left the workplace compared to 2022. That's a 22 data that's there. Either retirement or completely changing the fields, right? And if you actually look at burnout data, right, 24% of physicians perceives themselves to have clinical depression. 9% is even willing to even consider getting professional help for that because the physicians have zero idea that perhaps getting professional help can be useful. But more importantly, they fear that they're going to be stricken, that their license will be taken away from the medical boards as well, right? And so that's the environment that we're in right now. There's no faith in where the medicine is. And the technology is where we can make medicine great again, for lack of a better term, right? Where we can make medicine like in this box, where the clinicians actually becomes the leaders of the field, like what we were designed to do, right? The shamanic healers, the village leaders, and stuff like that. And that was my vision because I grew up seeing that 3-year-old running around naked with a stethoscope in my grandfather's clinic. So in China, the clinic is on the first floor, kitchen, clinic, and upstairs living quarters with me and all my cousins, right? And then downstairs is grandpa. There's definitely no EMR at that time, right? And so you have this giant line of people all the way outside holding fish, holding bread, holding fruit, right? And the reason I'm 6'3" and 270 pounds is I ate most of that stuff, right? As a kid, right? And so I've gotten the nourishment of what my grandpa did, right? And so a big portion of this is not just evolving medicine, is taking it back to reality, making us be a whole lot more human again. And we have to use those ancient wisdom for us to get there, right? And so right now through our nonprofit, the Physician Transformation Institute, we've realized something. We've realized that there's no institution that exists right now that's of a soul plus technology, right? Now, originally this conference was supposed to be spirituality and AI married together, but I thought this was a little too early for people. So instead we're doing it in Costa Rica in May, spirituality and simplification event in Costa Rica. And so I want to predict what we're going to talk about, but I have no freaking idea because literally that's a few months away and we're doing this right now, right? And even yesterday, there's big news on OpenAI and they're actually getting people to create their own GPTs for sale onto OpenAI. And this is supposed to be launching sometime in the next few days. Yesterday at noon, they announced in an email to all of us, right? And so we're like, holy hell, where are we right now, right? And in the weekend, I made an engine to understand 2024 CPT codes I can inquire from. There's new Medicare alternate payment platforms, one called the Guide Program for Dementia. There's a 125-page like book on what it is, reimbursement. I can't barely read. I'm going to upload this into the GPT.
Impressed with what you're getting out of ChatGPT.
I am.
Recently, I got myself Microsoft Azure Cloud Services with a huge amount of store credit. Thank you, Microsoft. I love you. And the access to the models that they have there. Oh my God. What you can do if you're willing to pay $5 a question. It's just a sneak peek of how far this goes in 6 months.
Of course, in planning for this conference, I was planning to just talk about ChatGPT. And then you got Gemini that came out, right? The other large language model. It's been building, but now they just released called Gemini, right? And you have other LLMs, you have Claude and all these different large language models that are there. But the idea here is how the hell do you execute this? How do you even utilize this within your own system? And we're going to talk about that right now. Any questions so far? No? We're doing pretty good here? Okay. All right. Thanks, Robbie. Appreciate you. You can come up here anytime. All right, let me go through this section. Sound check, still good? Thank you. It is a great, sorry I have to erase it really quickly. Oh, damn it. I broke it. Okay. All right. Anybody have auto mechanic background? Just me? Okay. How about mechanical engineering? No? Okay. In a lot of machinery and engineering and systems and processes, there's a way of solving problems. In fact, it's actually how I practice medicine. Okay. And I didn't make this up. A Japanese guy did, named Ishikawa. That's called the Ishikawa diagram. And the Ishikawa diagram is fascinating. Okay. In fact, I'm sure these guys at ECW use it all the time to try to solve big problems. The other name for the diagram is called the fishbone diagram. Okay. If you're going to be going to med school, you got to know this. This is actually really cool because I actually used this in medical school because I am terrible at memorization, but I like to solve things, right? Thanks. Okay. Robbie, have you heard about the fishbone diagram? I'll draw it out. You might know about it, right? I'll draw it out. Okay. The fishbone diagram is simply this, is that this is the spine of a fish, okay? Anybody like to eat fish off the bone like me? Grew up around the beach in China. That's what we did, okay? It's like an arrow, right? So this is the spine of the fishbone. And then you have ribs come off of it, just like this. Okay? So it's called a fishbone. And in fact, if you have Microsoft 365, you click on whiteboard, the first thing to pop up is a fishbone diagram. It's the most commonly used problem-solving technique in Microsoft 365. And I want to show you something. I want to show you how I use this clinically, and then I'm going to show you how to use it operationally, and then I'm going to show you how to scale. Okay? All right. Somebody give me a symptom, any symptom, any symptom. Headache, runny nose. Let's start with headache first, okay? Okay, so the fishbone diagram is trying to solve a problem. Headache is the literal head of the fish. What is headache? It's the literal head of the fish, okay? And so the idea here is that we're trying to figure out what is the root cause of the actual headache, okay? We're not saying come for Excedrin. We're saying let's figure out the root cause. And you can actually do this really quickly, all right? And did you know there's only 6 root causes in all of medicine, okay? And engineering, okay? 6 root causes. I'm gonna start up here. Beliefs, okay? Environmental, okay? Materials, okay? Tools, all right? People, all right? And self, okay? These are everything in medicine revolves around this. Everything in medicine, okay? The problem in medicine is that we usually are really good on these 2. We suck on the other ones. We're terrible at it, okay? Who said headache? George? All right, so let's go with headache. Pretend you have a headache. Why do you think you have a headache? For chronic headaches. Sleep, okay. And why didn't you sleep well? Traveling. Okay, where were you traveling to? Where were you traveling to? Miami. I almost busted on a Will Smith song just now. I used to live in Miami. Yeah. Okay, why'd you go to Miami? Vacation. Awesome. With who? Oh, awesome. Wife. Vacation. Why'd you go on vacation with your wife? Oh, okay. Y'all are in Miami. Okay, Miami to Colombia, right? Okay. There's Miami and then there's Colombia, right? Okay. And you were traveling, right? Why would you want to travel with your wife to Colombia? Want to stay married? We just got to here it is. Why do you want to stay married? What's up? Also enjoy Colombia. Great. Colombia is great, right? Enjoyment. Okay. Why do you enjoy Colombia? Okay. People. Colombians. Weather. Okay. What we did here is that we asked the overarching questions called the 5 whys, right? I asked you why 5 times. Technically, it's 6. 10 I did. I asked you why 5 times. The headache that you got, okay, has an entire component over here that we never talk about, okay? Now, in the doctor's office, usually is I have a headache. The first thing we would say is, where does it hurt? Okay? Point to where it hurts. Okay? So we call this the show me tool. Show me where it hurts. Point to where it hurts. That's a tool. Okay? What hurts right here, doc? It's right above my right brow. All right. Awesome. How long has it been hurting for? Okay. And then we have a timing tool. Okay. This is your HPI. That's right here, right? All right. What about severity and intensity? We are so fixated on the HPI to develop materials. Okay. Here's some meloxicam or diclofenac. I say diclofenac because that's the most commonly prescribed one in Colombia. I used to be there too. Diclofenac. No, I swear, or any sort of meds. Perhaps if I'm a holistic doctor. I'm like, hey, maybe you can get some acupuncture. Acupuncture. That's actually in tools. And then the acupuncture needles are materials, right? Maybe in functional medicine, we're like, what have you been eating? Lots of alcohol and really good bread, right? And so there's lifestyle, right? But that's part of the materials, right? So food. We're damn good at this. We're so good at this. And maybe like, okay, maybe I'm a dietitian. There's great studies on a ketogenic diet improving chronic headaches and migraines, right? Let's go keto, right? Keto. Majority of social media is here and here. Okay? That's a marketing problem. The value of physicians is here. Okay? First of all, I would like to say that congratulations on your headache, because I also want you to stay married. Okay? And congratulations on your headache, because man, I would love if you took me to Miami and Colombia and have a good time. It took me on vacation. And so the headache is a manifestation that happened. But how can you keep your people, keep your wife, keep your sleep, and still travel, but without an actual headache? In reality, we have to go from the left to the right. Most of medicine goes right to the left. This is called a transactional-based medicine, prescription-based medicine. This is called identity-based medicine, okay? And this is called a process-based medicine, all right? If you understand this, you can literally put any symptom here and have an understanding, all right? So this is what I do in my group visits with the patients. Dysautonomia, fibromyalgia, chronic autoimmune disease, chronic pain. They're our favorite patients because we literally go through this. Do I have to prescribe them anything? No, I could give them an idea of what are some things that we can really tease out. All right. Now, how many of you have read the book Atomic Habits? Atomic Habits? A little bit of the book? You like the book? Yeah. It's great, right? Atomic Habits has amazing ideas. The biggest idea is this. And if you were to write down anything today, it'll be this. So Atomic Habits, you have concentric circles that are right here. Okay? You have concentric circles that are right. And this is basically us. This is the human psyche, right? So you have the outcomes. Did they ever teach you this in engineering, Robbie? All right. Man, I can teach you something that's really rare. Thank you for that. All right, this is the outcomes. And then in the middle is called the process, okay? Process. All right, that's the middle circle right here. And the bullseye is the identity, okay? Or ID is the identity, okay? What's happening here, I should have used a different color. But I want to target an identity versus the process versus the outcomes. They all have different actual outcomes. I'll give you an example, okay? It's New Year's, it's January. I'm like, you know what? I'm gonna lose 20 pounds, okay? The term 20 pounds is a number. It's trackable. That's an outcome based, okay? All right, losing 20 pounds is an outcome. I want to go two sizes down on my dress. I want to have better skin, something like that, right? So these are outcome based. Identity based actually is belief systems, right? I want to find joy in my life again, right? I want to find joy when I go to practice medicine, right? That's more identity based. And then the process. The process is an effect of an emotion, right? Things that you do. For example, oh, I had someone over and this person is someone who's really close to me for some reason just irritates me. Anybody have anybody that's close to you that irritates you sometimes? Yeah? Well, we all should raise our hands, right? And so what happens is when this person's over, I go into my room, I just let them be, and I exclude myself. So that's the process, what occurs here, right? And so what happens in medicine is we're really good at outcomes. Keto, paleo, weight loss, HIIT workouts, right? Intermittent fasting, time restricted fasting, et cetera, all this health stuff. And these are all outcome based. Whenever we start with outcome based, the extinction level is greater than 98%, which means that if I start a habit by looking at outcomes, there's a 98% percent chance I will fail in literally less than a month before January's over, right? The reverse is true when you start on the identity, okay? Now, here's the thing. Identity-based medicine starts right here, okay? And identity-based medicine means that we start with the environment and the belief system. Now, why is the environment part of our identity? Any clues? Where we live, where our family's from, this is literally part of our identity. Where do we choose to be? Those choices are literally part of our identity. It's actually based on our belief systems, right? You can come in with a headache. I was like, oh, I got a headache. I was like, awesome. Did you party? Where'd you go? What'd you do? I traveled. Where'd you go to? Went to Miami, then Colombia, visited the family. It was great. Man, was that worth the headache? Was it worth the headache? It was totally worth the headache, right? Man, I'm so glad it was worth the headache. And let's celebrate together, right? Let's celebrate the fact that you got to go to these places. That's freaking amazing. That's freaking amazing. Perhaps we can keep what you're doing. Maybe let's figure out why you had a headache in the first place. Did you go by plane, by boat, by steam engine? How did you get there? So that's the process, right? And so I was like, all right, maybe if you go by plane, there's a lot of altitude changes and you may be having a lot of dehydration, maybe some water, right? So that's where the material comes in. But what I did is that I celebrated the belief systems and the environment in the first place. And that's what I train my staff to do on a daily basis. When you come into my office, is what are we celebrating with these? Well, think about that. No one's asked me that before. What are your goals for 2024? And then where do you see my role in your life, in your journey? These are two amazing questions to ask every patient when they come in, and you smile. Why? Because that's an identity-based questioning system. If they come in triggered, they've been waiting for a while, they will be immediately de-triggered because you're serving their identity. It's right here. So what happened when Ravi's example of the AI, right? AI asked identity-based questions better than humans asked identity-based questions. Humans asked the outcomes. The AI was able to recognize identity-based questions. Daily domestic violence, okay? That's an environment, okay? We missed it. That's an identity-based question. Why do you think the AI is so good at asking identity-based questions? Who's used ChatGPT? Anybody? Who used ChatGPT? Robbie, thank you. You basically invented it. If you use ChatGPT, one of the most powerful tools is an emotional-based response. your output sucks. I don't like it. And ChatGPT will say, oh, I'm sorry. Let's see if we can reframe it in this direction, right? Why do you think an emotional-based response has better output than the outcome-based response in ChatGPT? Because large language models have hacked humans by understanding our emotions prior to our actual language. And it uses language as the primary emotional powerhouse, like a juggernaut to power through. And this is why I think that AI actually helps us behave more human by asking about the identity. So if I was a tribal leader, let's say I'm a shamanic healer of a tribe, right? And then you come to me and you have a headache, right? And I'm full of wisdom here, right? And I'm this shamanic healer in a tribe. I'm in a hut. You come to me, it's like, shamanic healer, I have a headache. Here's some Excedrin. Am I going to do that? No, right? It seems ridiculous, right? Doesn't that seem ridiculous? And so what is the difference between a shamanic healer and a current doctor? Huh? They listen. Bingo. And we actually speak in belief systems. This is where AI outpowers humans, because I was not trained to do this in medical school residency. I was not, I'm sure you weren't either. We're not trained to do this. But now we have natural language processing that allows us to be us, because large language models like OpenAI is us. It's a reflection of us. There's so much money that's spent on doctors who you got to be more empathetic to the patient's needs. All doctors are freaking empathetic. We all are, right? But how we're going to get to here in 7 minutes and 12 seconds of the average primary care visit face-to-face with a patient, and 40% of that time is actually spent on the computer, right? So you're really getting about 3 minutes of visualization time with the patients, maybe, if you're not an awkward doctor, right? How can we even get here? It's really difficult. And this is where the AI can really come in and try to bridge that gap. And I tell patients this: by the time the patient sees me, they've binge watched my YouTube videos. I have 500,000 followers on my Facebook. They binge watch my Facebook content, my interviews, my podcasts. They think they know who I am when they walk in the door. And it's because of that, I get here really fast. Hey, why'd you come in? Oh, I saw you on these YouTube videos, Dr. Nathan Bryan talking about nitric oxide and how it can perfuse the brain to decrease dementia symptoms. It's really cool. I was like, hey, that's really awesome. But hey, why are you really here? Who brought you here? Tell me about your people, your environment, your relationships, your beliefs, right? And when I say beliefs, I'm not talking about religion. I'm talking about, what is your belief system? Do you believe that I am this mystical healer that can heal you with dementia? If that's the case, that's not necessarily true, because it requires a partnership right here, right? And this is an identity-based line of questioning, once again. And when I saw Ravi's AI output, I immediately went to my Ishikawa diagram, my fishbone diagram, and plotted out the first patient. Plotted out, boom, boom. I'm like, holy shit, this is doing it better than I am. And it did not involve a like psychiatrist to be part of that mix. It only required another human to do it. So we can actually elevate the role of humans to do this. So it doesn't matter what type of medicine we do, endocrinology, functional medicine, internal medicine, et cetera, all right? We have the ability to harness this actual power. And then our outcomes becomes amazing. So I'll give you another example. I have a metabolic group, okay? We call it a weight loss group, but that's just to get people in. And in this group of 6 months, I didn't say a single thing about food or diet. I said, we're gonna cross these out completely. I'm like, sorry, if you came and wanted to do, that's not what we're talking about. We're gonna go here. We're gonna go here hardcore. May not be comfortable at first, but we're gonna get there, okay? So 6 months, we took people down this challenge. And this challenge has multiple phases. The first phase is a balance sheet. Now, I like numbers. Who else likes numbers? I like numbers. We like numbers, right? I like numbers. I was like, life is a balance sheet. And on the balance sheet, you have 2 sides. Usually it's expenses and money coming in, right? And that's usually what the balance sheet is, right? And so in human psychology, all right, it's avoidances, okay? It's things that you avoid. and it's excitement. Yeah. Desires, not just desire, but super excited about desires. So let's say you're looking forward to visiting your family in Colombia right here. So vacation. Now, life is a balance sheet. By you having excitement and desire about something, you technically have to be avoiding something else. So we go through, what are you avoiding? Okay. Maybe you're avoiding too much work. All right. And so what happens is that if life is a balance sheet, the things that you're excited about and things you avoid also go on this diagram. And we try to see in life's balance sheet, where are you in terms of your process and your belief systems that are right there? And we did this for 6 months. We had a 100% retention rate in the group, 6 months. Okay. And everyone set their weight goals. Okay. There's 52 members in the group. What percent of people met their weight goals in 6 months? Guess. Huh? 100%. What's 100%? I didn't talk a damn thing about diet or nutrition and exercise. Why do you think that was? Because they're not lacking tools. They're so overwhelmed with tools by looking at social media all the time. Dr. Gundry, Dr. Mark Hyman, you can look at Dr. Ludwig and all these different things that are out there, right? The vegan diet, the pegan diet, the carnivore diet. I'm like, I don't care what diet you're on. All I care is about this. You choose your diet, you choose your tool, right? But why, when people are seeing them, they look slimmer, they look younger, they look happier, right? And they're like, what? And they get asked, what diet are you on? They're like, I don't know. They actually don't know what diet they're on because they're not really on a diet. They're on a spiritual enlightenment. Now, I use this as our outcomes data to get more Medicare funding for lifestyle medicine. In reality, what I'm doing is an identity-based medicine that's already been proven in multiple industries of the highest performing people that are there.